All right, thank you, Ms. Ankita. So firstly, good morning to all the viewers, and thank you for joining us in this conversation about breast cancer, to just get more awareness, get more enlightened about this topic that we're here to discuss today. Um, we are super happy to invite our two panelists, Dr. Neeta S. Nair and Ms. Anita Mittal. It's absolutely a pleasure to have them here, and they'll be telling us about their experiences, what they've gone through, what they've noted about, and I think it's going to be an absolutely splendid conversation today. So thank you for joining us, Dr. Neeta and Ms. Anita.
Thank you.
All right, so our first panelist for today is Dr. Neeta S. Nair. She is a professor and consultant surgeon for breast cancer services at Tata Memorial Center, Mumbai. So Dr. Neeta, I'd like to begin by asking you, as a doctor, what exactly motivated you and to specialize in breast cancer services? Like, why did you choose this stream?
So I think that's, it's not as simple as an answer. I think I always knew I wanted to be a surgeon for sure. But I think with breast cancer, it's probably one of the happier cancers to be part of, because if you pick it up early, you know that you can cure it. And you can do so much. And I think women are the foundation of every home. So when a woman falls ill, the family crumbles. So if you're able to help her through that journey and you're able to get her out happier and, a satisfied customer, so to speak, because she's happy with her treatment and you've got her across that bridge, then I think that makes the difference. So it's more motivation on patient happiness.
That is such a beautiful thing. So I think this is one of those occupations where you actually choose streams based on happiness of the patient. I think it's splendid, Dr. Neeta. So the next question is, what challenges do you often face with the patients? Any specific experience that you'd like to share with us? Any struggles that you've had in the past?
So I think that, India as a whole, you see both spectrums. I think there was this WhatsApp circulating which showed a petrol pump and a bullock cart both at the same time with the current petrol prices. And that's the reality of India. We've got both extremes of a socioeconomic status. So if you get patients that come from both streams, and at Tata, we tend to see exactly that. You'll see women who have great families backing them, supporting them, financial concerns not being an issue. And you're able to offer necessarily what is the best evidence and the highest quality of care. At the same time, you also see an average working woman, the maid in your house, that kind of family, or even a lower socioeconomic status coming in. And for them, this is a struggle. When you talk to them about therapies needing a little over 3-4 lakhs just for basic treatment, it's really a struggle. And I will say that all organizations, including VCare, and I've said this before, is we cannot function as clinicians without the help of all our patient advocates and all our NGOs, because it's a combined effort. It's not just the patient that you're treating physically. There's financial toxicity, there's social toxicity, there's everything else that comes with it. So if your patient's going to struggle about where am I going to get money to get treatment from, she's not going to take the optimum care. Fortunately, at Tata Memorial, because of all the help that we get from our NGOs, from all our partners, including the government, we're able to offer that even to our lower socioeconomic strata. One of the examples I could give you is trastuzumab, which is used very routinely for a type of breast cancer. When I started working in the field, and this I'm talking about is 12 to 15 years back, it used to cost us about 11 lakhs just for that therapy. Today, not only have we got biosimilars into the system, we've realized with science that we can give shorter courses of the same drug. We've also got so many partners helping us to administer this to patients that we've gone from 4% of our patients being eligible to take it to right up to about 67%. And I think that's very heartening for us, because if you're able to treat your patient well, that's the whole answer. We got happy stories. A lot of patients who come back, they come. You can see Anita smiling there, and you see happy faces. There are a few sad stories also, most of which come from social isolation. Patients whose families don't understand that this is just a journey. This is not their whole story. Once you get them through the journey to the other side, they're going to be fine. They're going to probably be stronger because they've been through so much. And I think being left alone in that, which you do see with some families, I think is what these women struggle with. And we do have some of these stories, unfortunately.
Yes, absolutely. Thank you, Dr. Neeta. So previously, we asked our audiences on different social media handles whether they wanted to ask any questions regarding breast cancer, whether they wanted to get a little more aware about it. And so here are a list of questions that our audiences had for you, Dr. Neeta. So the first one is, when should one start screening, or how should one check for breast cancer?
So what I will say is that breast cancer, when detected early, is curable, is definitely treatable easily. So you want to be able to be aware. There's a difference between the concept of awareness and screening. Being aware is understanding what your breast feels like, knowing that if you see any new change in your breast, you will have it addressed. So I would recommend that everybody learn how to examine themselves. It takes you about 5 minutes while you're having a bath. You use 3 fingers and you use the pulp of 3 fingers and you palpate your breast. You use your breast as a circle. You divide it by 2 perpendicular lines and you now have 4 quadrants and a center. You palpate from the outside in. You never hold like that. If you hold like that, it always feels like you have a lump in your breast. So understand what your breast feels like. All of us have lumpy, bumpy breasts. You know what's new for you and you know when to go and see a doctor. 80% or 90% of the lumps that come up are not going to be malignant. But for that 10% that may be malignant, we miss the opportunity of detecting it early if we do not go in and see a doctor. So I would say self-breast examination creates awareness. It's the best tool to do, and teach it to everyone, all the women that you know in your family, in your social circle, so that we're all able to do something for ourselves. As for what is screening, screening as a national program is not something that we recommend really in our country because we've got bigger health concerns. But as an individual, what you need to know is if you have family history of breast cancer, you need to possibly get your family member who's positive tested for a BRCA mutation if they were young. So if this is a woman in her premenopausal state that below the age of 40 had breast cancer, she should possibly look for mutations, then the whole family gets tested. Otherwise, for a regular individual, from the age of 50, you can do a clinical breast examination. Let's go to a healthcare professional that's trained, get a clinical examination every 6 months, or a mammogram once in 2 years. The reason we don't recommend these as just standards saying that, do a mammogram, do nothing about it, is in between the mammograms, if you're going to be complacent and not examine yourself, you may miss something. So awareness is the first step forward that we make for ourselves.
Definitely. So the next question is, what treatment options are typically available? And do you recommend a specific treatment option, or does it really depend on case-to-case basis?
So the way breast cancer works is, and we hear this a lot, is that, if I'm in an early stage, why am I getting so much treatment? You must understand that there is surgery, which is you get operated. And I must say this, breast cancer does not mean removal of the breast. We are able to save the breast in over 70 to 80% of the women. It's definitely safe if you have early breast cancer. With slightly larger tumors, we can bring the size down with some medication and then operate and save the breast. There's a very small proportion of women that continue to need to have the breast removed, and you can have reconstruction options offered where you create a mound under the skin and you're able to have a mound of breast which is your own. So surgery is the mainstay in treatment. In addition to that, you have chemotherapy, which are certain drugs. You have targeted therapy, like I mentioned, Herceptin, and you have some tablets of hormone therapy, and you have radiation. Radiation is certain beams of light that are given out, and that's also local therapy. When you treat breast cancer, you treat it with an amalgamation of all these modalities, depending on what is best for that patient. You may end up getting all 5, you may get only 2, you may get only 3. It depends on the tumor type. It depends on the tumor stage. It depends on the type of surgery that we offer. So it's really a amalgamation for what is best for that patient. But understand that just because you're getting more does not mean that it's advanced. It just means that's the way breast cancer treatment works.
Right. So I just had a question based on that. So I think there's this common misconception that breast cancer equals surgery. Can you just let us know a little more about that?
So breast cancer equals surgery just means that you need to take the lump out. You need to test the lymph nodes in the armpit, that's the axilla. So yes, it does entail surgery, but the surgery does not mean removal of the breast. The surgery often enough is just a part of the breast, which is the lump and surrounding tissue, which is normal, and testing of the axilla. We have a lot of patients who are on long-term follow-up, all our patient advocates who are around, who will tell you if they've had breast conservation, if it was offered to them, they've done well and they're doing absolutely fine without local recurrences. There's safety in certain things that are offered to you. If it's not offered to you, it may be because the disease extent does not allow it. But if it's offered to you as breast conservation, it's definitely safe to do.
Right. So can a breast cancer patient exercise? Is there
Absolutely. So we actually recommend that women with breast cancer exercise. I will talk to you a little bit about two of the studies that we've looked at. One was the addition of yoga while you're taking your treatment and then continuing into follow-up. It was a large study, 850 of our patients participated in it. We're looking for some long-term results, after which we'll release that report. But what we have today is the quality of life difference with the use of yoga for women taking treatment for breast cancer and follow-up. There is a definite difference in the way these women reacted to treatment. They had less side effects. They had less cancer-related fatigue. They had less pain. So it's a very simple intervention. When I'm talking about yoga, I don't mean asanas like jumping around and doing power yoga. Even something as simple as meditation, basic exercises, stretches, help a patient considerably. There is enough evidence today to tell you that exercising while on treatment, while you're on follow-up, is good for you. There's a 63% reduction in the risk of recurrence if you reduce weight also. So it's extremely imperative to exercise, lose weight, be healthy. And a healthy mind and body is probably our best defense from anything coming back or anything happening in the first place. What you need to realize is when we say exercise, it's how much your body allows. For each individual, it will be different. Let your body talk to you. If you're able to do a certain exercise, you can push yourself a little bit, but stay healthy. Definitely do a brisk walk. Unfortunately, COVID gave us a lot of stress because of that. You can't go out, you can't do anything. Do a little yoga, do a little meditation in your own home, do a few stretches in your own home. If you have access to a space where you can walk with, a good brisk walk is also often enough, just good for you to do. But exercise, a definite yes.
So Dr. Neeta, you mentioned about these studies that happen. So I think one of my latter questions was related to this. A lot of patients do ask and do kind of, they're a little skeptical. Should they participate in clinical trials? Is it safe? And does it help you eventually?
So what I will say is that we've been one of the pioneers at Tata Hospital, and I think Dr. Badve and Dr. Mitra started some of the largest randomized studies in India in cancer. And we've been able to do, what I can tell you is that there has to be a relationship of trust. So most studies will not be, it's not that you're a guinea pig. That's not how research happens. Research starts at a cellular level, that you do it in the lab. It moves to smaller animal studies that are safe, and you don't even, it's not something that's going to torture the animal. It's done very safely, and then it moves to patients. By the time it moves to patients, there's an element of safety that you've already established. You know certain things, and we moved so much with cancer care and treatments for cancer that you're now literally looking at two standards of care being discussed. Today, you know that saving the breast is possible because some women participated in that study in the early 70s, where you were able to analyze that taking out the breast versus saving the breast, is that possible to do? And we reap the benefit of that today. So if you don't participate in research, you're really not being fair to the next patient who's going to come forward. I think we reap benefits of the previous studies, and it's only that we can give back to science in that way. Participating in studies allows you to, one, definitely either get standard of care or better treatment, and it allows you to help women in the future, just as you are benefiting today.
Right, absolutely. So the next question is, does breast cancer affect fertility or your ability to have children in the future?
So unfortunately, it can. It potentially runs the risk of that, because when you give chemotherapy, chemotherapy does not recognize cancer and normal. Chemotherapy recognizes cell division. Cancer is just cells that are dividing very rapidly that have gone out of the control of the body. So it recognizes cell division. In trying to attack any cell that divides is where you get side effects related to chemotherapy. And the ovary, because we know that we have a cycle every month, grows and develops or has changes that happen every month and is in a process of division. So chemotherapy can potentially act on that and reduce the activity in the ovary. So it also impacts the type of follicles that develop, and it can also impact the work that the ovary does in terms of the estrogen that it circulates. So yes, it can. But today we've moved forward in so many ways. Something as simple as giving an injection which suppresses the ovary during chemotherapy will allow chemo not to recognize the ovary and spare it. So that's the first simplest step that we do. It isn't, now, unfortunately, I cannot tell you that you're going to get pregnant or not, because if you haven't tried, I don't know whether you can. But what I can tell you is that we can suppress the ovary and allow for ovarian function to be regained. So that we can offer with that drug. We have various fertility options like assisted fertility options of embryo preservation, oocyte preservation that can be discussed with patients. They are a little expensive, they are invasive, but they are options that are discussed with young women who want to have additional modalities that they'd like to keep on the side.
Dr. Neeta, is it the same case with men as well? Does it also affect
Yes.
their
So
body?
it's the same process. It's the same process, which is why you choose to do. See, with men, it's a little easier to store sperm. With women, unfortunately, it's invasive.
Understood. Thank you. So often patients do get a little stressed or paranoid after diagnosis. So do you recommend taking multiple opinions at that time, or like before they start treatment, or is it just going to get them a little more confused?
So unfortunately, and I say this a lot in the clinic, is when you get diagnosed with cancer, the first thing that everybody thinks of is why me? And then the second thing that everyone thinks of is, oh my God, this is it, that's the end. So you need to get them past that to realizing that you need to stage this correctly, you need to diagnose it correctly, and you need to start the most appropriate treatment. Cancer is not something that comes up in a day. Most women have had a lump for about a few months. It's been growing for about 6-8 months. There's going to be no panic in starting treatment in 38 hours. It doesn't work like that. You need to have the appropriate stage, appropriate treatment processes done to stage it and to plan it correctly so that you move forward. There's nothing wrong in taking multiple opinions. The point is work with a doctor you feel confident with. You have to feel safe in a space. You have to believe that you're going to get better. And a positive mind and positive thinking is what's going to get you forward. The treatments are fairly standard. They're fairly similar for most people will practice. You're not going to see very different treatments across different groups. You may see a difference in the crowd, I think, between a Tata and anywhere else, but you have to believe in the space that you're getting treated at. There's enough evidence to tell you today that if you are positive in your thinking, the hormones that circulate in your body are going to enhance your therapy. If you're negative in your thinking, the hormones that circulate in your body only have a negative impact on you. So if you're in a happy space, you trust your doctor, you will be able to do a better job for yourself.
Absolutely. So we did mention radiation therapy a little earlier when we were talking about different treatment options. Are there any potential side effects? Can it affect, the human body generally?
So unfortunately, no treatment comes without morbidity or side effects. All treatments do have some concerns that can come up. We weigh out the potential benefits and the harms of each treatment before we offer it to a patient. So radiation is local therapy. It's like you hit your hand once, you get hurt. You hit your hand 15 times, you're going to have a little swelling and it's going to be a bump and a bruise there. So radiation is not a one-time therapy. It's multiple sessions that happen depending on what is necessary for you, for your stage and tumor type. And based on that, yes, there can be local toxicity on the skin. Yes, there can be long-term morbidity to the lung in terms of that when any tissue heals after radiation, it causes what's known as fibrosis. Fibrosis, that it restricts the expansion of that space. So that's the way skin would be. So it loses its elasticity. So the lung can get a little fibrosed. These are things that you can see 15 to 20 years later. But the benefit that radiation offers if you need it is much more and tenfold to that morbidity. The simplest thing, and I say this on every patient or general forum, is the day you can promise me or guarantee me that if I'm walking on the road, I am not going to get hit by a car, is the day I will tell you we have treatments that are not going to give you morbidity. You're still willing to cross the road. You're still willing to take that chance. You have to believe that treatments are given for you with the risk benefit taken into account.
Absolutely. I think that's a very valid example given.
It's as simple.
Yeah, definitely. So after one is treated, what is the risk of them getting other cancers, and are their family members at risk?
For family members at risk, I think, just as we had mentioned in the beginning, if you have someone who's had breast cancer at a young age, or you have family history where your aunt or your mother or your grandmother has had breast and ovarian cancer, or you have 2 or 3 aunts that have breast cancer or ovarian cancer, these are known risk factors, because then that's suggesting that there's something in the family that's causing more than one member to have it. Please understand, familial cancers are less than 10% of breast cancer. 90% of breast cancers are sporadic. We still have no clue why they happen. Out of those 10%, BRCA1 and 2, which are the most common genes, contribute to about less than 5% of that percentage. So you're talking about out of a span of 100 women, 5 may potentially have risk of genetic mutations, which are BRCA1 and 2. And then we would want to test the rest of the family to understand, does anybody else have that mutation? Having the mutation does not mean you're going to get cancer. It just means you're at a higher risk of it. So we would change the way we screen you. For women who do not have the risk of getting cancer that is that high, we recommend any sort of evaluation after the age of 50, be it a clinical breast examination, be it a mammogram. Women who have genetic mutations and have a higher risk, we would advise that you screen earlier. We use slightly more sensitive imaging sometimes if needed, and we screen earlier. It's as simple as that. As for what you can you get cancer? Unfortunately, science is not maths. It's not 2 + 2 = 4. So when I give you statistics and I tell you that today your risk of cancer of coming back has reduced by 95%, I don't know which part of that 95 you're going to fall on in the future. Are you going to be the 5% where disease does come back? Are you going to be the 95 where disease does not? Little bit only time will tell us. But again, same analogy. You don't stop living life because of the risk of disease coming back. You know that you have done your best, both as a patient, as a clinician. You've done what is necessary for that cancer, and you've reduced the risk of it coming back with the multiple modalities that you use. Can it come back? There's always a small potential risk, which is why you stay on follow-up. You see your surgeon every 6 months. You get a mammogram once a year or once in 1.5 years. And if you have symptoms, we evaluate it further.
Absolutely. And there is this reconstructive therapy that we're talking about after breast cancer has been cured in females. Do you recommend that? And can you just enlighten us a little about it?
So how reconstruction works is there are 2 ways to do it. One is a partial breast reconstruction, which is that if you save the breast and the amount of tissue that's removed requires us to place something in there so as to maintain the mound, that is usually done at the same time as the primary surgery is being done. A second type of reconstruction is that when you remove the whole breast, then you need to recreate the breast. That can happen both at the time of the primary surgery or 6-8 months after treatment is completed, when you're more comfortable and you feel that, okay, now I want to discuss various cosmetic options. What it requires is that there are various methods in which you recreate a mound. You can either use the patient's own body tissue, which is the fat and the skin that is used. Most often, we use the area from the tummy. Indian women, as we are, have enough of that. It allows for us to have enough tissue to create a nice big mound there. You can also use area from the thighs, the buttocks. These are plastic surgery procedures that are done. Another option, of course, is the use of an implant. But implants have their own problem. You may need to change them at a later date. You have to know the point of, you may need expansion of the skin before you place the implant. So it can be a 2-staged procedure. The plastic surgeon is the person who can evaluate you for what is the best option and then offer that to you. But I will say it's extremely safe to do. As is with any surgery, there are risks with everything, but it's an extremely safe procedure to do, and it's an extremely individual choice to make.
Definitely. That was all that I had for you, Dr. Neeta. If you'd like to add anything, that'd be great.
So I will say that treatment of any cancer is a team effort. It takes a plethora of surgeons and medical oncologists and radiation oncologists and radiologists and pathologists to come together to do this for them. But it cannot happen without patient advocates and NGOs. And I believe that all our NGOs and all our patient advocates make that extra difference. And I've said this before, we treat the physical aspect of it, they treat the emotional aspect of it. And I think without both happening together, patient care is not complete. So I'm going to thank the entire team from VCare for this. And I think it makes a lot of difference to us and our patients.
Thank you so much, Dr. Neeta. I think it's been an absolute pleasure to have you here today. And I think our audiences have definitely, just increased their level of information about breast cancer from this conversation.
Thank you.
Viewers, our next panelist is Ms. Anita Mittal. She has been a breast cancer warrior and a patient advocate with VCare for more than 15 years now. So welcome, Ms. Anita. It's absolutely great to have you here.
Thank you.
So, yes, Ms. Anita, go on.
Can you hear my voice?
Absolutely, yes, I can. All right. So, Ms. Anita, can you just enlighten us a little about your experience with breast cancer?
You see, when I had breast cancer, it was with one thing is the cancer name in itself is a death sentence. Because we associate with this because of the movies, because of the books, everything we feel. But I will tell you, I want to tell the patients also that the breast cancer, if you touch, you know your body. Doctor has explained everything beautifully to the patients. You know your body. If any change comes to your body, you touch yourself and you know it. It's there. Something is different. And I know it's not easy to go to hospital, doctor. It's better to check yourself every month after your menses, after 5th day of your periods. And like I will say that, like young girls, tell your mothers and your aunts that don't be scared of cancer. One thing is not to be scared of cancer. It's very important. I know it is very scary. And what doctor said that why me? Why? That thing comes to your mind. Definitely it comes to your mind. But a time comes when you change the challenge into opportunity. You have to move forward. You cannot stop yourself. And it's better to take multiple, meet with different doctors where you feel comfortable. You do it. You have to see the distance, the things, everything. Everything matters. And your family matters a lot. And the other thing is that for women, we feel that apart from giving a milk to our children, our breast is a beauty aspect. That's the thing. So that's why the sexual aspect comes in that. If your husband takes you as you are, he accepts you as you are, then it's okay. But you cannot stop there. There are many options because when I had cancer, it was 20 years back. Now a lot of new options have come. If you don't feel comfortable, do the resection. There's no problem about it. Because then you will feel all right. Otherwise, VCare provides the size of your breast, because when you will get a process will be little straight. It will not, because with age, the breast goes down. That is the thing. So we normally give in VCare, we give a process one size smaller than the other breast. And if you have got the breast cancer in one breast, that doesn't mean that the breast cancer cannot come in the next breast. So you have to take care of your body.
Absolutely, thank you. Anita, which treatment did you opt for at the time, and how exactly did you go about it?
You see, for me, I was in the clinical trials. I used to fill all the forms also. And I went to I had my chemo, I had my radiation. I did everything. And for doctor gives you 5 years. Every year you come, every 6 months, first 6 months you come for checkup and your mammography. After 5 years only, they tell you now you are okay. That okay doesn't mean that you feel that okay, relax, but you have to move on. That's very important. One thing is not to be scared to take decisions in life. It's very important. And
Yeah.
of course, money part comes. But there we have lot of NGOs now in Tata who help, and WeCare is one of them.
Definitely, Miss Anita. I think the entire role play of NGOs in today's day and how that they've just increased the reach to a lot of people. I think that is definitely up the treatment options for people available.
WeCare's mission is this only: they help the people to providing free and total support to cancer patients, and especially who are financially low. We give them the money also. So that is the one part I really love about WeCare also.
So Miss
Tanvi, can I say something? I
Yes.
have to see that bright smile on Anita's face. And I think that's what patients need to take away from, is that there is so much positivity in life, even after
Yes,
that.
definitely.
You have to give credit to that women who go through that and they come across and they keep smiling, I think are the biggest credit to any of our work.
Thank you.
Definitely, Miss Neera. I think that's a really big takeaway from today's conversation.
Dr. Neeta has spoken to a patient about all the aspects of the problem. Yes, your positivity definitely makes a difference. Your family support makes a difference. But then you have to be strong in itself yourself. The first phase goes away. First phase, you feel, why me? Why it has come? But it has come. You have to take it. You can't stay away from it. It's your commitment to yourself. That is the most important.
Yes, Miss. So like we focus a little into the technicalities of breast cancer with Dr. Neeta, I want to focus a little bit on the mental health and how you maintain that. What were some strategies you used? How did you keep yourself healthy?
You see, the mental health is, you were asking me or Dr. Neeta?
No, Miss, you absolutely.
Okay. The mental health is very important. In the beginning, you are totally engrossed in your own treatment. The diet plays a big role. You can't say that I don't want to eat this, I want to eat this, I can't. This is not a correct thing, because you have to have your energy. So diet plays a lot of, and make your doctor your own confidant. Tell everything about, don't hide anything from the doctor. Even if you take a medicine, any medicine, tell doctor. Because he's your savior. Why to hide anything from him? Because after all, it's your body his cancer has attacked, and he's treating you. So the mental health is afterwards, you, as Dr. Geeta said, we do yoga, we do reading, we go for walks. Yes, my family, my people have supported me a lot, I will say. But the thing is, mental healthiness comes with your own resolve. Nobody can give you.
Definitely. Miss, so you spoke a little bit about how, you just have to stay healthy and stay positive. Sometimes, when patients are detected with diagnosis, they're a little scared to tell anyone about it because, again, there is this taboo in Indian society that, oh, breast cancer, oh God, it's going to eat you up or whatever. So how did you overcome that? I want to know a little bit about your story and how you overcame that sense of, I might not be okay.
You're right. You're right. In the beginning, nobody knows that whether they will survive or not. I have 2 daughters like you. And when they were marrying, when I got cancer, they were not married. They got married after my treatment. So I told them, tell your husband first that your mother had cancer. So that because the name of the cancer is such a scary thing, if they have to run away, they can run away now only. Not afterwards. Maybe for the other issues, but not for because of this issue that you have hidden this thing from us, that you didn't tell us. Not like this. So there is no, yes, definitely there are taboos in Indian society, because if there is a cancer with the mother, nobody wants to marry that girl. But it's better to share instead of hiding things. I feel that your relationship becomes stronger if you share things. This is my point of view.
Absolutely, Miss. So what is your role as a patient advocate at WeCare? How do you contribute to the organization?
I tell the patient, first thing is that where you are standing, there was a time when I was also standing there. So I have gone through this path. But the thing is, whether we become all right or not, but she said that you don't stop crossing the road just because some car will hit you. We keep on doing those things. So I tell them, if we have a fracture on the leg and we are in a plaster, we end up spend 3 months on the bed. So this is a treatment. Let the doctor do the treatment. You can become all right.
Definitely.
Stay positive.
Yes. So Dr. Anita, Miss Anita, when you had your entire breast cancer thing going on, did you feel any side effects from screenings or treatments? Did you face anything?
You see, the thing is, in the beginning, you have your energy. In the later stage, your energy with the chemo and everything, your energy goes down. That is the time when you have to be very careful about your diet. And radiation also, because they give the same place the radiation every day. And I took it for 35 days. So you have to be very particular about, and because they give you here, it can affect your throat, it can affect your lungs also. But the thing is, which is the worst? What is the worst thing? That is the thing. So you have to.
Definitely. So, Miss, any advice that you'd like to give our viewers today, or any patients that you encounter?
I will tell all the patients and everybody, all the young girls, first thing is, don't be scared. Yes, there will be times when we will be scared. I'm not saying that you cannot be scared. I'm not saying like that. You will be scared, but a time will come when you will think that it's okay. It's fine. I'm going through the whatever treatment is going on, is to let it go. And I will say what Dr. Geeta has said very nicely, that check yourself, because you know your body. It's very important after 5th day of your periods, you put your hand, stand in the front of the mirror and go clockwise and anti-clockwise. That's very important. And young girls, they don't have to worry about it, but you can tell your aunts and mothers, don't be scared. Earlier is detected, you will become all right. It's very important. Later stage, they do lot of, but then you have to go through a lot of treatment.
Absolutely. I think that was all that I had from Ms. Anita today.
Thank you very much. Thank you. It has been great listening to Dr. Anita also, and to meet you also. You're such a sweet girl. But I say that you people take a baton from us and spread the word around. Tell your mothers and aunts and anybody who is their friends, do the awareness, because we have spent our life. We did whatever and I'm still ready to help the patients.
Absolutely.
Jyoti can give my number to anybody. I will talk to them, and I will say that the talk The food is very important. The other thing is confidence in your doctor. Both things are very important. You can't, because Indian ladies, they will take care of everybody, but they will not eat their own good food, which is bad. Now you need energy. You have to eat good food, correct food. Not say chatpata, masaledar, pickle, not like that. But the food is which gives you energy, which is very important.
Definitely, Miss. I think awareness is very important. And even this webinar was a part of Hillspring and VCare's joint breast cancer awareness campaign that was going on for the past week. So we had a series of mythbusters and quizzes that were going around. So, you know, anyone who does want more information, you can always follow our social media handles to get more information about this. I think the more aware you are, it makes you a little more prepared for what is to come, if it is to come. So
if it is to come, if it is, it's not that it's, but we can help other people also. It's not that we have ourselves have to go through it. We can help other people also. We can tell them that at the age, whatever the doctor has said, that the age, you check yourself, and if you find anything, something is abnormal with you, then go to doctor and get yourself checked up. Why to be scared? Yes, but scariness is a part of life. We get scared with so many things, but when we don't stop living because of that.
Definitely. And with that, Dr. Neeta, do you have any closing remarks for us?
So I think for one, the patients make everything better. It is a patient's ability to go through any treatment that's going to work. It's her positivity and her strength that we can only supplement, but it starts from women within. And I think women are the strongest of the family. We hold the families together, and we need to believe in ourselves and be there for ourselves at some point of time. The one thing I will say is COVID has taught us we can go through a lot and come out and find different ways to live life again. We've come up with funky masks. We've come up with webinars. Social media is our best friend. So I think believe in the fact that any journey is just a little difference, and you'll get to the other side with a smile.
Definitely, Miss. So thank you, both our panelists. Thank you so much for being here.
It is lovely to be here to hear all the talk of Dr. Neeta and talking to you, meeting you, on whether on the Zoom. It's okay, because I can't come to the office now. You know, I live in Kandivali. For me, the journey itself takes a lot.
Definitely, I understand. But it's been great. And I think, Miss Anita, even if you don't come to the office, I think just your words of inspiration is enough to motivate all the youth to just be there and do a little more than they're doing. I think it's been great to have you here today. I think I have been a little more inspired. So I definitely hope that our viewers have enlightened themselves today. So thank you so much for being here.
Thank you.
Thank you very much for everything.